U.S. healthcare is the largest industry ever created by human beings. The National Health Expenditure Projections, 2022 to 2031, published in June 2023 by the Centers for Medicare and Medicaid Services, CMS, estimates that 2024 healthcare expenditures in the U.S. will equal $4.9 trillion, or 17.8% of the nation's $26.5 trillion economy. That number, $4.9 trillion, is massive. World Bank data for 2022 identifies Japan as the world's third largest economy at $4.2 trillion. It's almost impossible to believe, but U.S. healthcare expenditure now exceeds Japan's aggregate economic activity. By itself, U.S. healthcare is the world's third largest economic engine. If it were a car, healthcare would be a gas guzzler. Despite being the largest segment of the U.S. economy, or perhaps because of it, the healthcare industry overconsumes resources without delivering commensurate value. An October 2022 meta-analysis in Health Affairs pegged healthcare's administrative costs at between 15% and 30% of total expenditures, with at least half of that amount attributable to waste. The high end of that percentage range for 2024 equals $1.47 trillion. Unbelievably, at that level, healthcare's administrative expenses would be bigger in size than any other U.S. industry. Think about this for a moment. Administering healthcare services conceivably generates more economic activity than any other non-healthcare enterprise. Gargantuan as it is, the $1.47 trillion figure excludes the administrative sludge imposed on American consumers to navigate through the system. Jeffrey Pfeffer of Stanford Business School found that Americans spend 12 million hours per week hassling with health insurance administrivia. Over half of this activity occurs on the job. CMS projects healthcare expenditures will grow 5.4% annually and reach $7.2 trillion by 2031, representing almost 20% of the U.S. economy. For that to happen, healthcare will constitute 25% of the incremental growth, $2.5 trillion out of $10 trillion, in the U.S. economy between 2023 and 2031. With these projected growth rates, it's not surprising that private equity and venture funds are moving aggressively into healthcare. Private investment follows growth.